Well, our next guest poses the question, if you could have a simple test that would virtually eliminate your chances of developing one of the most deadly forms of cancer, would you have that test done? Well, the colonoscopy is that test, and the importance of screenings is not only detecting but also preventing colon cancer. Joining us today to talk about this is Dr. Harold Schwartz, the Chief of Gastroenterology at Griffin Hospital's Digestive Disorder Center. Welcome to the show, Doctor. Great to have you.
Thanks for the opportunity.
Well, let's start a little bit about, colon cancer. It is a silent killer, you say, and you say it often has no symptoms.
Right. The majority of cancers, especially when they're early, have no symptoms. Certainly some people may bleed. Some people may develop pain, but certainly cancers when they're early almost never present with any symptoms at all.
And you say more than 90% of it is actually preventable through screenings.
That's right, Desiree. Cancer doesn't start as a cancer, but 90% plus of the time, cancers start as what are called polyps. And polyps are benign growths. They're very small, and then over a period of many years to over a decade, they can turn into a cancer. Not all of them do, but some have the propensity to do that. So if you find a polyp prior to it becoming a cancer and you remove it, you're actually preventing the cancer from happening. So colonoscopy, which is the way that we do that, is now the gold standard for both diagnosing and treating those polyps.
Okay, very good. Now, what age should you actually have a colonoscopy done? Is there a certain age limit?
The average age for most people with what's called routine risk, which is that they may or may not develop a cancer at the age of 60 to 65,
okay,
would be to start a colonoscopy at 50.
All right.
African Americans, because they develop cancer and polyps earlier on in their life, usually should start at 45. And if there's a family history of colon cancer, depending on who it is and how many are involved, one may start either in 40s or 10 years prior to the onset of the cancer of that affected individual.
Let's talk a little bit about myths and misconceptions, because I think a lot of us kind of think of them as being painful. Are colonoscopies painful?
Well, colonoscopies generally aren't painful when they're done by the right gastroenterologist or the right endoscopist. They may have a little bit of discomfort when the air is being blown in or when turns are being negotiated. But the truth is, in order to prevent even those momentary episodes of pain, we sedate almost everybody. And certainly you can have sedation anywhere from what we call twilight or a light sedation to a very, very deep sedation where the individual has no idea what's going on.
That would probably be me. I'd want to have no idea what's going on.
Most people choose that.
Yeah, I don't blame them. So tell us a little bit about risks. Are there risks with this particular procedure?
The risks are pretty minimal. And the studies have changed over time, and most recently studies show that the risk of perforation, infection, and bleeding are certainly less than 1 in 1,000 and probably closer to 1 in 3 to 5,000. Those are the major risks. Perforation is the one that everybody's scared about. But again, when done in the right hands by somebody who's done a good number of them, that's really very, very minimal.
So tell us the most difficult part of this process. I mean, I'm sure it is probably just making the appointment is one of them.
Right. Two difficulties. I think the first one, as you really touched on, is the stigma involved.
Right.
People think about a colonoscopy as being something which is either distasteful or embarrassing, and so getting them to come to the appointment is the first one. I don't think there are enough preventive measures in doctors' offices, frankly, in primary care doctors, to inform them of what the procedure really entails, because if they knew that you could have a test done that would prevent cancer more than 90% of the time, most people would come. So access is the first one. Speaking of access, I think another problem is that we have some problems with deductibles, co-pays, and certainly people without insurance. And so there's really that roadblock to be able to get to preventive measures.
What's interesting is you mentioned earlier, and I think this is what a lot of us need to take home, is that it is more than 90% preventable. I mean, this is something that you can prevent by simply having a test.
Right. There are very few cancers that can be prevented. Most can be diagnosed, and I mentioned that, mammograms for breast cancer and prostate examinations for prostate cancer, but those are called diagnostic screening. You want to find early cancer.
Right.
The paradigm has shifted now for colon cancer. It's really one of the only cancers that one can prevent by doing what's called preventive screening and finding the polyp or the lesion that is not cancer yet, but if left intact would become cancer.
I want to share with folks, I know that in March it's part of National Colon Cancer Awareness Month, and you all offered free screenings for a couple of, well, not really a couple, several deserving folks who didn't really have the insurance to cover that. That had to be rewarding for you.
Right. I think because of the issues with access to preventive care, our society, the American Gastroenterological Association, has an initiative that on March 20th of every year, and this just started, that free screenings be offered to those either without insurance or without access. So we did that. There were 8 people that we did colonoscopies on. Some of those had no insurance because they had lost it due to lack of employment,
Right.
and other ones never had it. We found polyps in a good number of those, and everybody was very appreciative, and this is something we'll continue. But it really does speak for the problem I think we have that hopefully, some of the new aspects of the health law, the changes, will address.
So, Dr. Schwartz, for you as a doctor, what is the takeaway? What do you want folks to know? Is it just simply get tested? I mean, if there's something you could say to somebody out there watching, what do you want them to know today?
Yeah. Don't put it off because you're worried about what we're going to find. Some people think they don't want to have a cancer found. No, if you hear what I'm saying, we're not finding cancers. We're preventing one by taking out the lesion before it is such. And don't have a stigma about it. We don't care, what you look like on the outside. We only care about what you look like on the inside, and we want to make that better. So don't be concerned about the embarrassment. It's not a painful examination. So really just get this done. If you're clean, you're good for 10 years, and like I said, there's more than a 90% chance that you will not develop cancer in that period.
Perfectly said. Thank you so much. Listen, if you'd like to learn more about how you can schedule a colonoscopy, you can contact the Digestive Disorder Center at Griffin Hospital. Information's on your screen, everyone, or come to our website, WTNH.com. Click on Connecticut Style, and we will have the link for you. Dr. Schwartz, thank you so much for being here.
Thank you very much.
All right.